All right, good evening,
Excellent.
everyone. Thank you for everybody who's joining us today. I'm Lisa Partida with Home Again LA, and today we have our a special guest over. We have Claudia Flores and Walter Perez with Zocalo Health, and they are going to be talking about the services that they offer in terms of enhanced care management. Is that right? ECM services
And community supports.
and community support. So I'll go ahead and pass it along to Claudia and Walter.
Thank you, guys.
Thank you so much, Lisa. I appreciate you all so much for having us. My name is Walter Perez. I am so sorry my camera's off. I'm feeling both under the weather and my internet is not being kind to me. So, if you would like to meet me in person, I will take you up on it and buy you some cafecito and tell you all about what we do here at Zocalo. Before I get into introductions, I really wanted to kind of share a little bit about sort of why Zocalo and what brings me to this mission. My mom was actually a volunteer promotora for 10 years at St. John's Clinic. And so I got to see firsthand experience on what having someone like that could do to a community. And so when I found out that Zocalo Health was trying to bring together these case managers, these promotoras de salud to the community in all these different ways, I felt it was like kind of like a full circle moment for me. I felt like I could do a lot for the community if I could introduce folks to these services. So I appreciate you all for having us. My name is Walter Perez. I am based. Here is my email. Please feel free to reach out to me if you ever have any questions. I also have a nice little QR code here. If you ever want to book an appointment with me, need access to any kind of flyers, this is readily available for you. Please don't hesitate. Que no les dé pena. I'm here for you all. We also have a couple different assets that we like to share there too, like a video on what a cafecito de salud event looks like. So if you ever have any more questions outside of this presentation, please don't hesitate to reach out. I'm really, really excited because I get to do a lot of the sharing about our services, but I really love inviting folks who are doing the work in the community, folks who are actually helping out our patients. And I'm incredibly honored and grateful to have Claudia with us. Claudia is a housing manager, and I'm going to let her introduce herself.
Hi, everybody. So I am I can officially say I was the first
Claudia, do you want to
housing.
go ahead and introduce yourself?
Yes. Can you guys hear me fine? I don't know because I know Walter was kind of um, delaying a little bit there. So I am actually the first official housing navigator for Zocalo Health. Community supports started, I think, with my manager, Amanda, in March. I can't remember exactly what month where like the community supports was starting up. I started with Zocalo back in June. I have worked in the public sector field for many years, over 20 years. I worked at the courthouse prior. That was kind of my first official where I started temporary. And then I have worked in the human services with the human services agency for about 14 years. And the last 3 of those years was in the housing program. So I assisted families, individuals, the Housing and Disability Advocacy Program. So I have a wealth of experience and knowledge working in the public sector. Um, and the beautiful thing about Zocalo, like Walter was sharing, is that you do have a connection to the community. So Zocalo's mission really stood out to me and it was a difficult choice to make to leave a place I had been for over 10 years to come and work. But because of their mission, their values, and what they are doing for our community, it's what really stuck out to me. Because of the things that I have experienced personally with my family, always having to be that translator kind of for my mom, and things that we may have noticed or experienced ourselves in not having an advocate, and as a child, kind of having to be that advocate for your family. So, having the advocate is something that's definitely needed at this time. And so that's what allowed me to make the transition into the private sector from the public sector. That's just a little bit of information. My email is also here. I don't have a fancy QR code. I know Walter does a lot of like community partnerships, so um, you can email me at any time with any referrals or questions that you have, and I'd be happy to help you guys at any time.
Thank you so much, Claudia. Oh, I appreciate you so much. We Claudia is in the weeds, so to speak, actually helping the patients, and so I consider myself a hype man for her and all the promotoras that work for Zocalo. Uh, a little bit about why Zocalo started. I always like to share that because I think it resonates a lot with the different communities that we speak to. Zocalo Health is actually a result of our co-founders, Eric and Marisa, trying to make healthcare more accessible. Their parents that essentially struggled navigating the complexities of healthcare, trying to find a doctor that could speak Spanish, trying to find a doctor that could resonate with their children, trying to find different practitioners that they could communicate with in their style of communicating, right? They always felt like going to the doctor's office was a little bit difficult, a little sad. And so they wanted to make at the doctor's office. Why can't we have Spanish speaking doctors who can make this stuff incredibly easy to understand and honestly just culturally relevant, right? And so they set out to start an organization that would hopefully accomplish that through the Promotora de Salud, through the housing navigators, through these case managers that make up our organization. Now, we do that with three pillars of community that we like to always lead with. We call it access, navigation, and trust. As you all know, no one will ever trust a resource unless you can feel it, touch it, know their name. And so every time we work with the community, work with the patient, we lead with these three pillars, right? We need to make it accessible. Claudia will share in just a bit, but there's one thing on doing a presentation and meeting with someone telephonically, but there's another thing being in person and actually getting to know the individual and the organization and who you're working with. That's why we welcome all of that when we're working with patients and to link that bridge between us and the community, right? We'll be there in person. We'll bring cafecitos, some pan dulces to try to make the community connection that much more personable. We want to make navigation a little bit easier, right? It's not just booking something for someone, making an appointment for someone. It's really helping them understand what they're doing. What does your medicine need, right? What is it that you're signing up for? Trying to figure all of that out in a really understandable way so that you can help not only yourself, but your family, right? Sometimes when you explain something to a patient, they're going to go ahead and teach that to their family. And so we're doing all of this work in the event that it's actually going to affect the entire family. And last thing is trust. Once trust is lost, then it will be less likely for that individual to trust the healthcare system and the system that they're dealing with. So we always try to meet the patient where they are. We try to work with partners, try to make those community moments happen. And so every step of the way is just building trust as well. Now, I won't stick to this part of the problem too long, but one of the biggest problems we're seeing is that, healthcare is very expensive and a lot of folks just don't trust the system because we're having a big struggle navigating what that is. And so our solution, which is I really want to focus on for this presentation, is how do we solve for this? Well, for us, we believe those health outcomes are results of relationships. They're a result of uh, knowing what our patients and our community needs and building on that. Now, we're very fortunate because our promotoras de salud, our housing navigators, our case managers are all from the communities that they serve and they know those areas better than anybody else. They can tell you what grocery stores to go to. They can tell you what community resources to go to. They can tell you what parks are that have gone to those grocery stores. And so that's one of the biggest things for us. It's a relationship is everything when it comes to these health outcomes in Los Angeles County and how we could potentially help the folks in your community. Now, I know one of the questions that we all have is how much does this cost? Well, this is actually all free to the community member, so long as they are a under the Medi-Cal plan with the health plan that we're partnered with. So we don't charge anybody anything. That is not what we do. We work strictly with the health plans, and the reason for that is the health plan wants to improve their members' health outcomes. And they're noticing that folks are less likely to use these services that they offer because we are essentially building out those relationships with the community, with the members, so that they can use those services not just until the point of crisis, but more consistently and thoroughly, right? So we work specifically with these health plans. Not all of them are listed here. We actually work with a bunch of different ones in LA County. We work in Anthem, Kaiser, and we'll be launching in LA Care fairly soon. But in the event that y'all have someone in mind, in the event that y'all think there's a potential community member that would fit our services that would benefit from us, one of the things I always say is send them our way. We can help them. We can take care of them. We will do one of two things. One, we'll see if they're eligible for our services. Sometimes we have folks that are eligible for our services but need to re-enroll in Medi-Cal. We actually have folks that can support that, right? Uh, there are folks who've never enrolled into Medi-Cal. We can enroll them. But sometimes there are folks who aren't partnered with our health partner organizations that offer very similar services to us, but just aren't us. And then we'll do that in a very careful way so that they continue to have our support, but they'll get that warm handoff. We also support sort of re-enrollment. So if there's a member who's like, you know what, I've had this health plan for a while, but would like to switch, right? We're always very careful with that. We always want to navigate that carefully because there's a bunch of resources readily available. But again, if they want support, we're here to help them. And so what we're trying to say, if you have someone in mind, we're very community first. And so please send them our way. We'd love to support them any way possible, or at least get them in the door of someone that would help them just as well as us. So the first of these services that we offer in LA County is our Enhanced Care Management Program, or ECM program. This is us and our promotoras navigating the patient's medical and non-medical detriments of health. Any issues with finding a primary care doctor, understanding what medicine they're taking. We've had promotoras call patients and say, "Hey, you got your medicine on Thursday for their diabetes medicine on Thursday. You know, we got to make sure you're taking that. If you're not taking it, let's understand why. What is it that's stopping you? Is it routine? Is it the medicine doesn't taste so good? What can we do to help you, right? But there's real relationship there because there's relationship first for us. And then we also assess the non-medical detriments of health, right? This is, hey, I'm at the point of crisis because I'm really struggling to figure out where I can get my son or daughter tutoring, right? They haven't been doing so well in school, and I'm really, nervous about that. Or, hey, I don't have access to nourishment. I don't know where I can get my next meal from. Well, our ECM and benefit basically allows us to work with the patient to build out that wellness plan and help them figure out whether those resources are. So we'll connect them to a food pantry and help them get meals. We'll help them figure out what their medicine needs. We'll help them figure out what the bus route to their nearest park is, right? We'll do anything that it takes to make sure this individual is helped. These are 12-month programs that we can re-enroll in, and we service three populations of focus. We service folks who are experiencing homelessness or homeless complexity. So basically, if they're moving from house to house, we'll service those folks. We service what we call birth equity. These are Black and Indigenous mothers who are struggling to basically figure out what care looks like and just need some more support. We service mothers outside of those demographics, but those are right now our primary focus because they do need a lot of support, especially in Los Angeles County. And then we also service what we call high utilizers, folks who are at the point of crisis and are needing attention and just need someone to help them navigate these resources. But that is our ECM program. Now, our CHW program is our community health worker program. This is very similar to ECM, except we're solely focusing on the social detriments of health. All right. We'll still help them with that medical stuff, right? If they need help finding a doctor, chances are your promotora will try to help you. But the focus here is really trying to understand and help you with these social detriments of health. And so we'll do anything from health education, appointment preparation, translation. Uh, I was joking with Claudia before this call, like our promotoras, and she does so much relationship building. I've heard that folks talk about like recipes about food before they do any kind of actual case navigation. I've heard them talk about how they are struggling with figuring out where to take their kids this weekend, right? So it's real relationship first, but the promotora is really there to assess all of that, but also be sort of a soundboard to what you needed helping you get there. Um, so those are our two programs that sort of benefit each other and complement each other. Sometimes we have folks enrolled in our ECM and then they move on to our CHW. Sometimes we have folks in our CHW program that move to our ECM. It kind of just depends on the complexity and the urgency of care. Now, I could not do this slide justice because Claudia here is the expert in this specific service. So I'm actually really excited to present you all to Claudia, who is actually very, very involved in this as we speak. So, Claudia, take it away.
Hi, hello. I the biggest factor when we're working with our community, like Walter said, is we want that local housing navigator that is going to be able to connect you to the resources that are in your community, that understand your community, know the readily available programs to help you with your specific housing needs. So we treat housing as healthcare, right? It's to help improve stability with not only finding and securing housing, but being able to sustain that housing. So part of the community supports, it's a trio of housing services that is offered. Where it can start off as a housing navigation. We're assisting you finding affordable low-income housing based on your need, and then connecting you to the deposit assistance. And then following that could be the tenancy and sustaining services where you get that ongoing case management, help with managing your bills, budgeting, understanding your tenant rights as well as your tenant responsibilities, and then fully understanding your lease, and landlord mediation as well. So if that's needed, you're getting a notice, you don't fully understand it. We're kind of like that middle person that can connect with the landlord for you on your behalf and with you as well. So not just doing that exactly with the member, the patient, but helping them connect them and be that advocate for them. So this supports help like the support is for long-term well-being. It's for permanent stable housing. Part of community supports, it's not very different from any other provider. There is no rental assistance, but it is still permanent supportive housing. So we offer integrated care. We are person-centered, and it's a really big and very important thing to really state that we meet them where they're at. So yes, we are a virtual clinic, and a lot of times that's exactly what people want and prefer. They're so busy. They have their children they're caring for. They're maybe working, they're maybe in school. So they want that phone call. But we also offer in-person support. We've also offered flexibility in our calendars. Like our clinic is open 8:30 to 5, but we can, work around, hey, I'm off of work at 5 p.m. Can you meet with me at 5 or 5:30? So we can offer that flexibility and meeting them exactly where they are and what they need. So those services, yes, the like Walter said, we're not just we do have obviously our structured meetings where we're helping to navigate. There's the very first two structured appointments where we do a housing assessment, so we're identifying what potential barriers they may have to housing, um uh income, right? We're helping setting goals, so we want to understand how we can help you if you're searching for employment, connecting you to that low income income-based affordable housing programs, right? Helping to navigate those really time-consuming applications and wait lists and things like that. Um, we can connect to community resources. So community connections is really important. And again, that's why it's really important to have that local housing navigator. So with the housing navigation, like I said, it's a housing churro services. We will assist a member with searching for housing, completing applications, submitting referrals if they need that, move-in coordination. So we can also help to complete a walkthrough of the unit to ensure that it's a habitable unit. The housing deposit includes we can reimburse for application fees, security deposits, utility deposits. Certain plans may cover some allowable household items. You don't have a bed, you don't have a sofa, you don't have a kitchen table, you don't have pots and pans. And then again, for the housing tenancy and sustaining, housing retention that offers lease support, life skills also. So one of the things I didn't mention, if someone has never held a lease before, has never lived on their own, has had a lot of support, they've always lived with their parents, maybe they don't really understand how to cook for themselves or clean or wash, do their own laundry, things like that as well. So we do have some workshops that we can offer for them as well. And then the day habilitation program, not sure. I think it is available through Anthem. I'm not sure about the IEHP or the LA Care currently, but this is a social connection to help people who maybe have been outside of the community, not really in it, to kind of give them education in areas where maybe they need help to build a resume, um, social connections, things of that matter. But again, really important. We're whole person, um, building trust, building rapport, and it really comes down to consistency. So keeping on track, we're meeting at least twice a month, so every other week or so, but maybe it requires more often contact. So we're contacting you once a week. The beauty too, like Walter said, when we are meeting, like if we have a dual enrolled participant that maybe is in ECM and community supports, having that connection. I want to share a really good story about someone who's enrolled in the enhanced care management services, had a birthday that happened like in between my appointment with him and the appointment with his case manager for enhanced care management, and has diabetes, and he was sharing that he wanted a root beer float. And she was, talking to him about taking care of his blood sugar and, the things of that nature. And we were talking about like connecting for a specific resource for this member. And I was like, "Hey, have you thought of, they have a sugar-free root beer drink that I really like, and then they have like Carb Smart vanilla ice cream. Like maybe that's something that, we can share with him." And so I ended up purchasing that sugar-free root beer and the Carb Smart where it's less sugar, and showed up this was an in-person meeting that I had with him the following appointment, and I was like, "Happy belated birthday. I heard you wanted a root beer float." And it was just even that small connection. I let him know that his case manager shared that that's what he had wanted for his birthday, and he was just so like grateful. He expressed his gratitude towards that worker. Like, I can't believe, no, she didn't. I can't believe she told you that, and I appreciate you, and simple things like that. So it's really connecting with them, even outside of the needs that they may have, because we can see them as a person as well outside of this service that they're needing.
Wow, thank you so much, Claudia. That was amazing. I appreciate you for that quick anecdotal sort of experience. And then just wrapping up our presentation really quickly, we also are constantly in the community. And so please be on the lookout for any kind of cafecito event that we have. But if you all have any opportunities for us to join you, Lisa, I know you already sent over an invitation to something very exciting. That is to
Yes.
say, we would love to be a part of all of that. We would love to be a part of that. For us, it's being in the community, and that's how you build trust. If you're like, okay, Walter, I love this. I have family members. I have someone I'm looking at that might be interested in this. How do I refer someone? We have this very nice little QR code that you can scan and fill in this job form so that we can follow up with them. If you would like to stay involved, we will ask for consent from the patient that you're referring to let them know, hey, Home Again LA would love to stay involved in your journey. They love you just as much as we are going to love you. So is it okay if we keep up with them? Is it okay if we let them know how you're doing from time to time so that you all can understand where that patient you're referring us to is doing in their journey. But if you all want to just email me and just sort of have someone in mind and you think that's easier, please email me. If you guys want to email Claudia, please email Claudia. Whatever it is that you need, we are accessible to you. We would love to help you. Um, I appreciate you all. I want to open up the floor for any questions that you all may have. Yeah.
So I see in the chat that well, Cambria had a comment. She says this is exactly what she needs, and yes, not having housing is detrimental to one's health. And I'm sorry, Virginia says that she needs help and wanted to know how she can connect with you. So she says that her audio isn't working right now. But would I be able to like send a referral on her behalf? You said I would, right?
Yes.
Okay.
Amazing question, Lisa. Thank you so much. And Cambria, please, I'm so appreciative of your vulnerability. Yes, Lisa, if you would like, you can fill in this job form with Cambria and Virginia. Virginia, Cambria, I will put my email in the chat, but I will also put my phone number. If you need any assistance filling this in, please let me know. But please fill it in and we'll make sure to reach out and get connected and make sure we can help you as soon as possible.
I also just shared my email.
Thank
Um,
you.
yeah. Uh, we definitely, appreciate any referral as well, Lisa. And then for yes, thank you for being vulnerable with us and letting us know that you need this help. So any questions you have, you can shoot either one of us an email.
All right, will do. All right. I don't know if anyone else has any comments or questions. Feel free to unmute yourself if you're able to. If not, type it in the chat. Okay. All right. All righty then. I guess that'll conclude tonight's session. I do appreciate you both, Claudia and Walter. I hope you guys, I hope we continue to collaborate and, hopefully you guys can make it to the event. Yeah, and one of these days you guys have to bring that cafecito you guys keep talking about.
No, we keep hyping it up. You're right. You give us a date,
Yeah.
we'll be there.
Yeah,
We'll be there.
Yeah. All right, you guys. Well, have a good night and I hope you feel
they
better,
are so
Walter.
much fun. Yeah. Thank you. I'm
We-
sorry, really quickly, I
we-
just want to make sure. Were we able to get your guys' emails? Did you want to share that, or were you guys
Hold
able to
on.
see our emails there?
Hold on.
You
All right.
guys see, Cambria, you're Googling cafecito. There's a lot of organizations that kind of hold those. And then if you want, you can even look if you have Instagram. Zocalo Health has um an Instagram profile and you can see some of those. They're so much fun. You guys would really love that if there's going to be one near you guys to definitely go and check out.
All right. So is it all right with okay, I see Irma here. Thank you, Irma. All right. I was gonna ask for Leslie, I was gonna ask if you were okay with sharing your email as well. Okay. All righty.
Yeah, absolutely. Go through that job form, Lisa. Let me know if you need any assistance with that. But if you have any questions, we have your emails down so we can uh we're available just in case you need anything.
Okay, sounds good. I'll make sure to share the emails as well with you guys in case you guys have anything you guys want to share with them as well. And yeah, we'll be in touch.
Amazing. Thank you so much,
Okay, appreciate
Lisa.
you
Thank
guys
Appreciate
you.
you.
for your
Thank you,
time.
everybody.
Have a good night.
Have a
Thank
good one,
you.
y'all.